make it as described in the book. Okay? Now, the next item is a liver injection. The crude liver extract is extremely important to help rebuild the sick, damaged livers. We work very hard on the liver, so we also give liver extract and B12 to also help the cancer patient to rebuild bone marrow and rebuild blood. Because it's very interesting. I've seen it under the black microscope. You can see the tumor tissue ingesting, eating red blood cells. They thrive on them. They eat them up. So it's not at all unusual for cancer patients to be anemic. So we also work with the B12 and the crude liver extract to help the anemia, to help the bone marrow, help the liver. We work with all the organ systems, all of which are damaged before you can even have cancer. Okay? We also have the next item, fresh cow's liver juice has had to be discontinued. The animals have an epidemic of infections, and we've had to discontinue it. It doesn't make a big difference, though, because we get all organic food. We are giving capsules of the liver powder, and we are having excellent results. The therapy continues to work as is. We give niacin. Next item is niacin, 50 milligrams. We give 6 times a day. Niacin does 2 things. Niacin helps to open capillaries, helps to bring the freshly oxygenated blood back into the system, into the tumor tissue, which can't stand the oxygenation and dies. But niacin also helps in the protein digestion. What protein digestion? You're only getting vegetarian protein. What protein digestion? Tumor tissue is protein. You've got to digest this protein. It's got to be broken down. But not only tumor tissue, arthritic tissue, lumps and bumps and all of these tissues. Also, we are able to dissolve kidney stones and gallstones and so on. All of this can be done with the right enzymes, opening capillaries and getting the digestion in function, in shape. Okay? So niacin helps in 2 ways. Opens capillaries, improves circulation, cold feet, blue toes, all of this goes away, everything turns nice and pink, the feet are warm again, hands, fingertips are warm again, and circulation is vastly improved. The next item is acidopepsin. That is stomach acid, hydrochloric acid, plus pepsin. It's a well-known fact, well accepted, that in most chronic disease patients, they're lacking stomach acid. So we supply it in the form of the acidol, the hydrochloric acid. Plus, we give pepsin, which is also a digestive enzyme. We just help the whole digestive system. We help to digest the tumor tissue or other disease tissue. We help to break down old scar tissue. We are even able to overcome people's epilepsy, which is scar tissue in the brain, and that sort of thing. All of that can be done. That's part of it, giving the digestive enzymes like acidopepsin, and further down at the bottom of the page, the pancreatic enzymes. Pancreatic enzymes are active by themselves to break down tumor tissue. But given in the proper combination on this therapy, they break down and digest tumor tissue. In most people, if they have adequate pancreatic enzymes, they could not develop cancer. Because the pancreatic enzymes recognize and digest malignant tissue as foreign tissue. So why do people have cancer? Because they eat so much meat and animal proteins that the pancreatic enzymes are all used up in the digestion of foods, and there's nothing left over to protect you. So if you'd only stop eating meat and animal products, you're almost certain not to develop cancer. Now, wait a minute, I want to make very clear. There are some people who tell me, oh yeah, but I'm a vegetarian, how come I got cancer? I said, you were drinking milk. Yeah, I drank a lot of milk and I ate cheese. Well, that's animal protein. You were using up your pancreatic enzymes in the digestion of milk and cheese. Then I get people telling me, no, I wasn't taking any milk or cheese. I said, well, wait a minute. Are you married? No. Well, you must have eaten a lot of pasta and canned tomato sauce. Yeah, I live on that. So I said, well, what kind of nutrients are in there? What kind of nutrients is in pasta? It's white flour. There's nothing in there. Where's the vitamins, the minerals, the enzymes? Nothing. And canned tomato sauce is dead. It's canned. It's cooked to death and kept. It won't spoil because there's nothing left in it to spoil. So if you insist on eating dead and rotten and preserved foods, you can't get well or be well, even if you are vegetarian. Vegetarian alone doesn't prove anything. You got to know what you're doing. Vegetarian, organic, live foods is what we are talking about. Not dead, denatured, processed, useless junk. Okay? Okay, so the enzymes are important to help the digestive system to help assimilate. So we give not only the digestive juices, the acids, the acidol, but we also give pepsin and pancreatic enzymes. Very, very important. Then you'll also see on there an item marked lubile. That's a bile powder, an ox bile powder, which we use in combination with the castor oil to make the castor oil enema. That's already pretty sophisticated. The 10% solution of caffeine potassium citrate is almost unobtainable. But coffee takes its place. The coffee does the job. So forget it, you don't need it, just use the regular coffee as in coffee enemas. Then there's one other item marked linseed oil, and that is flaxseed oil, and I covered that at length. And that covers the medication page. Questions? All right.
How much thyroid are you talking about?
How much thyroid are we talking about? It's exactly outlined on page 235. How much thyroid is given? We start...
I had a thyroidectomy. I have a small portion left. I had really bad side effects from the thyroid. And when they took me off of it, I was fine. I've been fine ever since for
all right.
15, 20 years.
Yeah, but then there's a question. You have cancer.
No,
well, then that's a whole different story. We use a certain amount of thyroid, and Dr. Gerson explained why the thyroid is so important in order to help activate the immune system and the whole metabolism and the burning. If you don't have that problem, then you don't need to take any more. You're probably in balance. That's fine. Now, for the cancer patient, in the beginning, if they've not had chemotherapy, we give 5 grains of thyroid a day for the first 2 to 4 weeks. That's reduced to 2.5. Plus we give Lugol. That's all outlined on this page. Okay? Are there other questions?
Is there any of this that one would use for prevention?
Is there any of this one would use for prevention? Then you would go to the back of the book, Appendix 1, which tells you what to do for a less intensive therapy for non-malignant disease. Now, if you still make this less intensive, then you have a good preventive diet. Okay?
I didn't find this Pauline mentioned that increased vitamin C is good for cancer. Why does he have that opinion?
Vitamin C helps to detoxify the body. And in his case, his vitamin C patient, given large amounts, did well for a number of weeks, a number of months, but eventually died. Because he was able to detoxify them for a period of time. But eventually the body breaks down. There is no one vitamin that will cure cancer.
I don't think he said it was cured. I think he said it was...
I know, it doesn't. Okay.
What about injections of vitamin C?
What about them? What about injections of vitamin C?
Well, we can inject more than we can take orally.
You can inject more than you can take orally, that's true. And what do you expect to... What do you expect to achieve?
Well, what problem does he have? He has that,
Okay, injecting high amounts of vitamin C can be very helpful, especially in infections. It does help to control infections.
he was dying of, you read his book,
Who?
Norman Cousins.
Oh, yeah, he had cancer.
Wasn't cancer?